Welcome to a Nordic showcase of innovative Nordic technology solutions looking for new partners for co-development and partnerships targeting Singapore, Southeast Asia, and the rest of the world. My name is Riku Mäkelä, and in this talk I represent the Nordic region, represented by Nordic Innovation House Singapore in Singapore. The Nordic countries and the Nordic region are located in the northernmost part of Europe. The Nordic countries are Iceland, Norway, Sweden, Finland, and Denmark. We are all big exporters of world's leading innovations and technology solutions in many areas. Some of our globally recognized companies are 100 or more years old, such as today's 5G and telecom technology companies Nokia and Ericsson, or medical technology company Novo Nordisk. Spotify is a great example of younger world-class companies. In Singapore and at Tech Innovation 2021, we Nordics work together to connect innovators and solution providers to new partners in three thematic areas: sustainability, health, and smart cities. The Nordics are big in sustainable development. We have embraced the idea of circular economy for a long time. For example, we recycle all drink containers and have been doing that for decades. The Nordic region aims to and will become carbon neutral by 2050. 29 years from now. We have solved many pressing challenges back home and continue to offer our proven solutions globally. These solutions cover solid waste management, water cleaning, agricultural technologies, sustainable materials, and many other subsectors. Health and overall wellness are cornerstones of happiness. We have continuously developed our healthcare systems, and we are in the forefront of digitalisation in healthcare. One of the reasons for our innovativeness in healthcare sector is close cooperation between companies, hospitals, and other key players of the ecosystem. In fact, the leading hospitals in the Nordics run a network called Nordic Proof. It lets startup companies, local or foreign ones, to test and pilot their solutions in public hospitals. Regarding innovative solutions, pharmaceuticals and medical and health technologies have been one of our fastest growing export sectors for over a decade. Smart cities are about smart city planning, good governance, and many other things in addition to using technology's smart ways. When people in city of Helsinki redefined 5 years ago their smart city strategy, it was summarized in one goal that sounds simple. Smart services will save 1 hour of citizens' time every day. In technology side, Nordic companies offer world's leading solutions for digital infrastructure, digital services, smart buildings, smart mobility, and all other sectors important for cities of the world. Our joint operation, Nordic Innovation House Singapore, connects Nordic innovators, startups, and scale-up companies to Singapore and Southeast Asia. Our team includes representatives from embassies and trade offices of all Nordic countries. Please contact us to learn more about the Nordics and cooperation opportunities. And now I wish you will enjoy learning more about the highly interesting companies and their technologies in this Nordic showcase at Tech Innovation 2021. Thank you.
Hello everyone, I'm Alvin Tay, and today I would like to present you with the first CE mark sepsis prediction algorithm. First, introducing our company. At Algodex, we develop clinically validated machine learning algorithms that save lives and reduce healthcare costs. Led by David, Joachim, and Inger, we possess more than 20 years of industrial experience in commercialization, biostatistics, and research and development of medtech products. Our chairman of the board is Thomas Morrison, the owner of Nordics' leading EHR provider, Cambio. And besides having a multifunctional team with founding experience, we are also supported by Uppsala University in Sweden and Vinnova, Sweden Innovation Agency. Sepsis, a major killer. In fact, sepsis kills more people than breast, bowel, and prostate cancer combined, accounting for more than 35% of hospital deaths. However, sepsis diagnosis is always a challenge. One, it does not have reliable biomarkers. Two, its syndromic nature. Three, in the hectic ICU settings, current solutions depends on the clinician's skills and experience to manually tabulate clinical and lab information for sepsis diagnosis, time-consuming and highly subjective. Faced with this unmet clinical need, we developed Norway Sepsis, a clinical decision support tool that accurately predicts sepsis onset in adult ICU patients up to 3 hours in advance, using only common clinical data points. And to eliminate extra examinations and manual tabulations, Norway Sepsis will integrate with your existing EHR systems to collect the data points it needs for prediction. By assisting early treatment, we can shorten the patient's length of stay by half a day, thereby reducing treatment costs by 7% yearly. While for the hospitals, cost savings will be even greater when factors such as productivity costs are included. Hence, we aim to greatly reduce time until first clinical intervention, the length of stay, and costs incurred. Next, with a total accuracy of 86%, our algorithm has also proven to outperform existing early warning systems. At present, Norway Sepsis is the first CE mark sepsis prediction algorithm with the largest randomized clinical trial ever conducted. The clinical trial will complete in September 2021 with over 300 adult ICU patients enrolled from a major Swedish hospital. Following that, a prospective multi-centered study will be conducted with GE Healthcare, which includes over 1,000 adult ICU patients. With our solid traction from Norway Sepsis, this has paved the way for our product pipeline, which includes the prediction of acute kidney injury, flare-ups in inflammatory bowel disease, and hepatitis B. At Algodex, we value high trust, academic level, and evidence to back all our algorithms' performance and benefits. This is achieved through extensive research and scientific publications while forming partnerships with hospitals and EHR providers. Overall, our aim is to improve patients' outcomes across various clinical settings and reduce healthcare costs by providing accurate prediction, diagnosis, and treatment support. Through tech innovation, we would like to explore market opportunities beyond Sweden, forge strong relationships with EHR providers and healthcare organizations, and seek collaborations to adapt and test-bed Norway Sepsis. Last but not least, we are open to new business opportunities and investments. With disease prediction algorithms, let's save lives and reduce healthcare costs together. Thank you.
Hi everyone, we are from Brighter AB. Today we are going to share our data-driven smart solution in managing chronic conditions. We are a Swedish-based health tech company. In Brighter, we believe that managing chronic condition should no longer problem anymore. And that is why we create solution at the moment in battling one of the highest chronic conditions, diabetes. I am pretty sure that almost all of you have heard about this disease, and then maybe one of your family is currently battling with this disease. And yes, in Southeast Asia, 1 in 12 adults has this disease, and 37% are remain undiagnosed. That leads to almost 300,000 people in 2019 dead by this disease. And that's why we create Actis as our solution. And why should we use Actis? So let's check this video out.
Diabetes is the world's fastest growing chronic condition, affecting some 463 million adults worldwide. It's estimated this will rise to 700 million by 2045. At least 1/3 of adults with diabetes are dependent on insulin and need to check their blood glucose values and administer insulin every single day, in some cases, many times per day. This often means carrying a lot of equipment, such as a lancet for taking blood samples, a blood glucose meter, an insulin pen, a logbook, test strips, and needles. It's a lot to keep track of, and sometimes equipment gets forgotten, which means blood glucose may not be checked often enough, or insulin doses may be skipped or not recorded properly. In fact, only around half of chronic disease patients follow their treatment recommendations. Poorly managed diabetes may cause health complications, which can account for up to 80% of the total costs related to diabetes treatment. This is why we have developed Actiste, the world's first unified diabetes care device with an inbuilt mobile connection, developed with a vision of supporting better diabetes management. With Actiste, you can take blood samples, measure blood glucose, inject insulin, and more, all with the same device. By combining multiple diabetes care functions in a single device, Actiste is aimed at minimizing the number of actions required for daily self-care. Actiste automatically logs all treatment data and syncs it with the Actiste companion app. Here you can set targets, monitor progress over time, and much more. Actiste is aimed at helping people with diabetes to stay on track for healthier patient outcomes. Better adherence to treatment plans can improve glycemic control, lower the risk of health complications, and reduce the economic burden of diabetes. Actiste can help to minimize administration too, as lancets, test strips, and needles are automatically resupplied. Our vision is to ease the burden of living with diabetes and free up more time for nurses and doctors to spend on providing care. It's what we call the benefit loop, our vision of using real-life data to provide patient feedback, improve motivation, and drive behavioral change. All data is processed in line with both GDPR and relevant local regulations, providing insights into blood glucose control, injected insulin, and more at the local, national, and even at the global level. With Actiste, we aim to improve the lives of people touched by diabetes and ease the burden on healthcare systems around the world.
Yes, with Actis, we can manage diabetes more frequent, where a study in Singapore showed that a frequent follow-up increased quality, reduced complication, and lowering the cost of diabetes treatment. That's why we provide technology as combined package of device in Actis Mini and its consumables, and also services in companion app and also AGP report that can be shared to the healthcare providers and then the family. And since we are now expanding in Southeast Asia, we are looking for more partners. It could be healthcare providers, it could be telehealth providers, or even government that has the same vision with us that thinks chronic condition should be no more problems. Thank you.
Hello, my name is Marko Kärkkäinen. I'm a Chief Commercial Officer from Klevat Oy from Finland. Today's subject is turning the tide of marine pollution. Klevat company saving the seas. We are from Finland and we are a very innovative company. Our vessel cleaning water from plastic, oil, and excess biomass. Our technology is patent pending technology from Finland. And we also do with the snow removal and snow cleaning, but that's for the northern atmosphere. Today we are target for Ministry of Sustainability and Environment, NEA, all investors, angels and collaboration partners, governments, environmental ministries, ocean environment, ports, shipping companies, universities, R&D organizations. Because the problem is huge. Every year, 10 million tons plastic leaks to the oceans and rivers. There are already 250 million tons. In our company, we do ocean and river cleanup project, oil spill cleanup, support, together with the cities, collaboration with environmental agencies, corporate partners, research institute, and we do floating labs to the rivers and oceans. We want to train people and share our skills for everybody because the problem is huge. We want to be a part of the SG Green Plan 2030. The next level of the plastic removal will be that we use satellite, that we can recognize where are the microplastic, where are the plastic current, where are the harmful vegetation like algae or sargassum. We have already started collaboration with some universities in EU level. Our method is very unique. Our vessel is very unique. It can collect in plastic, harmful vegetation, and oil spills. Here is a picture of our newest vessel in Helsinki. Together with the Helsinki City Municipality, we do cleaning at the harbors last summer. It's CE labeled, commercial track glass. It's very easy to relocate it everywhere in the global. Our system is unique. We use a normal flow of the water, suction system. It's very effective. We can collect it up to 250 cubic meters per hour. And we go so small particles, 0.5 millimeter. So that means that we can collect the microplastic, comparing a conventional system, which are collecting plastic bottles, etc. As I said, our system is transportability is very high. It's a multifunctionality is high. We have created innovative financing contracts, new business model as a service. More efficiency, more impact, more bang for the buck. Here you can see some of our example projects, like in Helsinki, we collecting marine plastic and pollution from the harbor areas. Then we have had the project going on in the US, Lake Okeechobee, the second biggest lake in the US, together with the US Army Engineering Corps. We have done oil spill cleaning in Kotka, eastern part of Finland, and Eurasian watermill for removal in the western part of Finland, Kokkola, our home city. We are going to start in this month also in Cebu City in Philippines. We are collecting and cleaning 7 rivers. Our global presence is so spread all over. We have started project in Florida. We are near to start a project in Nicaragua in Central America. We are already in Southeast Asia, and we have done testing and project in 13 countries in Europe. Whatever we are collecting, we want to create a value chain. For plastic, there is several global players who have already done business with us. And all the materials what we are collecting, like organic materials, we have a biogas industry or composting. We want to create collaboration with the universities and R&D centers because there's a lack of knowledge of plastic on the oceans. And more information we can get, that we can do better solution. We are part of the global partnership of Maritime United Nations. The problem is huge and it's global. We create ecosystem for marine plastics. We have a diverse team. We have got awards and recognition globally. We are calling all. Let's save this ocean together. Thank you.
Hi everyone, my name is David Bergendahl and I'm the Regional Head of AI at Crayon. Crayon is a publicly listed IT consultancy with more than 20 years of experience and more than 60,000 customers globally. Our global data and AI practice was started in 2014 with the goal of helping our customers to derive further business value from their cloud-based data. At this time, we have a growing team of more than 80 experts that supports our customers from strategy development to model implementation in all modern AI technologies, such as computer vision, natural language processing, and data insights. Our expertise is globally recognized by our industry-leading partners, such as Microsoft, AWS, and Google. And this is due to our proven track record of more than 100 successful AI and machine learning projects. So as part of these projects and internal R&D, we sometimes identify areas that has the potential to disrupt industries and processes. And some of these technologies would benefit from having the industry insights of a partner to successfully go to market. So today, I'd like to share 2 such examples with the hope that you will be that partner. These solutions are among numerous AI machine learning solutions that we have developed at our Data and AI Center of Excellence. So please reach out to me if you have another opportunity that you would be interested to collaborate on. So our first technology covers the agriculture industry. And currently, the process of counting and estimating the weight of animals in the agriculture industry involves significant resources, and accuracy is difficult due to animals' movements. So because of this, farmers are using their tacit knowledge to estimate if an animal is ending its growth stage before weighing it manually. Now, each weighing increases the animal's stress as well as the surrounding animals, which affects their eating habits and can affect the quality of the end product. So by removing the animal's exposure to humans as part of this process, the risk of contamination and increased stress of the animal is reduced, providing a higher quality end product. Our solution utilizes proprietary computer vision and machine learning technology to accurately identify animals and estimate their weight without any human interaction. It can be applied in any areas where humans are monitoring animals utilizing their vision to track the growth stages of an animal, or where counting of animals is currently done manually. Compared to other potential technology solutions, such as IoT sensors, our technology allows for the identification and tracking of multiple animals using just one single camera, making it a highly scalable solution. So by reducing the animal's human exposure, we can reduce its stress and risk of contamination, resulting in a higher quality product. And this has already been proven to increase farm staff efficiency. Our technology can be used as the foundation of a machine learning powered animal husbandry management platform to track, count, and measure animals and their behavior. So with the data gathered, further analysis can also be done to provide organizations with data-driven predictions and insights that can improve their operations. Our second technology we'd like to highlight covers inspection of infrastructure, such as payment, which is a time and human resource heavy task as well. It is also a traditionally very tacit knowledge-dependent task that leverages on inspectors' experience to make their decisions. So even as machine learning has proven to be dominant over traditional deterministic solutions in the last decade, the automation of infrastructure inspection has been a difficult task due to occlusions, shadows, and noise in the images, such as road signs. And because of this, it's still a heavily laborious manual task. So our proprietary developed technology is able to automatically identify anomalies in infrastructure, such as cracks and other damages. It provides inspectors with automated reports and insights on the areas of importance instead of having to survey the area in person or manually view images and video footage. This gives them the right information at the right time to support them to make more accurate decisions while ignoring image noise. It has been proven to significantly decrease the time of large-scale inspections, and one such example includes reducing payment inspection effort from 1 week to 1 hour per hectare. It is easily scalable while removing the need for the inspector to be on site, and it can automate any inspection process that is visible with top-down drone imagery on non-reflective surfaces, and it also complies with ASTM standard for payment evaluation. Potential product areas include machine learning powered infrastructure inspection platform to support organizations to easily identify anomalies and damages and track them over time. The data gathered can also be utilized to develop further predictive maintenance models. So here at Crayon, we're always looking for great potential partners to collaborate with. So if you're interested in collaborating with us to further develop and prove the feasibility of our solutions in the region, please reach out and let's start a discussion. Thank you very much.
morning, afternoon, or evening. I'm Balder Johnson, Vice President of International Business at Imatis. Imatis is a Scandinavian healthcare software company based in Norway. It was founded in 1991 to provide real-time data management for the oil and gas industry. In 2003, we started to provide e-health solutions and have focused exclusively on healthcare since 2007. We have now earned the reputation of being one of the most innovative suppliers of health solutions in Scandinavia. This year, Imatis was acquired by the DNV Group as part of their new and ambitious expansion plans into the digital health market. DNV is a global expert and an independent expert in assurance and risk management, with over 15,000 employees and operations in more than 100 countries. Our head office is located in Norway's 7th largest city, Porsgrunn. We empower healthcare to adapt to new ways of working. We understand that healthcare workers are a mobile workforce. Despite giant leaps in technology during the last 10 to 15 years, healthcare staff are still predominantly using an IT paradigm designed for stationary office work. They need IT to support them where they work, which is on the move. Healthcare also needs better communications. Hospitals and clinics run on synchronous communications, most commonly using internal phone calls to seek information, make requests, and receive acknowledgements. This is extremely error-prone and a source of safety incidents. Communications need to be traceable, precise, and in a closed loop. Healthcare wastes time and needs to improve productivity. 20 to 30% of healthcare workflow is related to logistics. Hospital staff walks long distances, which can average 5 to 7 kilometers per shift. They're calling for lab results for the doctor, for services such as food, patient transport, cleaning, technical services, etc. Here is a great opportunity to improve productivity. Healthcare has high staff turnover. Employees leave due to burnout for a better job away from the front lines, contributing to chronic shortage of staff. Research shows that 1 in 5 nurses have left the job 10 years after graduation. Healthcare needs to attract the best talent with new ways of working, a more productive and serene workplace that's digitally enabled and silent. One of our users, Stephen Orr, a nursing home doctor, describes the difference between manual versus digitally enabled processes. He says, more attentiveness to signs of risk and patient safety, and is visually easier to remember than written text. Our digital solutions promote situational awareness and ensure security in communications. Imatis provides a rich portfolio of innovative solutions developed in close collaboration with our clients for hospitals, community care, and home care. It is designed to work with existing IT assets. Our solutions support clinical logistics, mobility, and closed-loop role-based communications, creating a silent hospital, service logistics, patient logistics, comprehensible presentation of clinical information for patients, patient services and engagement, patient flow, task and process management. We are looking for service partners for delivery, integration, and change management, go-to-market partners, and technology partners in the fields of sensors, robotics, analytics, and AI. And of course, last but not least, we're looking for customers. I invite you to contact us for more in-depth discussions. Thank you for your time and attention.
My name is Petri Martikainen. I'm the founder and executive chairman of Moprim, and Moprim is about mobility data. Moprim builds unique user mobility data to businesses, so we are specialized in gathering individual users' data very efficiently, recognize the mode of transport out of the data, and then create new mobility behavior data sets, whether they are for travel chains or personal carbon footprints, and then deliver that to businesses, whether it goes directly to their mobile apps or to other services. Why we are doing this? So the need is quite clear. So there's a changing landscape on people's mobility due to the new modes of transport. Also, COVID is changing people's way to move on the daily lives. But there's a very little understanding on this change. So to drive those change and understand the revenue streams, we should understand also the change in mobility patterns. And the data for actual personal mobility behavior is missing completely. That's what the Moprim is solving with the technology. So in this event, I'm presenting new technologies, two of them, one which is a complete turnkey platform for measuring people's mobility and invite people to communities, and the other one is the deep tech technology. The first one is a called Move Together platform. It measures all the mobility of the individual user in the background. It visualizes the mobility in various ways, the travel times, travel chains, personal carbon footprint, it calculates that ready as well as transport modes detected. It also shows the routes, but it also includes the revenue stream model for companies. So there are communities what the companies can buy and invite users, gamify them, even award those achievements inside the communities. All this is built, available, the full cloud mobile applications, whether they are white labeled or branded in some way. The other one we have is called Transport Mode Discovery. This is a deep tech algorithm-based service that it's been developed in Moprim over the 5 years, and prior to that in the local university in Helsinki, Finland. It includes number of AI and machine learning-based algorithms based on thousands of hours of recorded mobility data. There are built different kind of engines to use on wearables or mobile applications to recognize these modes of transports in real time, and in addition, a cloud service to release that results to mobile applications or different kind of wearables. This technology is available worldwide. It's also patented in major commercial regions around the world. For this event, we are offering different kind of partnership opportunities with Moprim. First of all, we are willing to find licensing agreements, especially for this transport mode discovery, or support a market commercialization, especially in the Asian regions. We are welcoming co-development efforts, especially on localizing these services, yet different kind of investment models. So we are keen on finding partners in different regions to work together with us to support the mobility data change, to support the take of the platform in use for move together purposes, and to license this transport mode detection. And I'm warmly welcoming all of you to visit our booth at the Nordic Innovation House Pavilion at this event. More information also can be found in our website at moprim.com. Thank you.
Hi, my name is Evgenia. I'm presenting Pulsar Company. Pulsar provides continuous, contactless, and remote monitoring of vital parameters of elder and bedridden people. By 2025, there will be more than 900 million of people in the world at the age of 65 plus, and this number is increasing, and the problems will also be increasing. In hospices, neuropsychiatric hospitals, senior homes, and other palliative care facilities, an acute shortage of medical staff and timely medical care have become a great problem that results in people's sufferings and, unfortunately, death. For this reason, more than 1 million of elder people die each year in Europe. The death rate after falls has increased by 30% in 10 years. The US budget for this problem is more than $50 billion per year. So our customers are senior homes, hospitals, hospices, senior palliative care facilities, neuropsychiatric hospitals, caregiver services. Pulsar system solves the problem of timely providing medical care when seizures, falls, significant changes in vital signs happen. So Pulsar solution can record changes in respiratory rate and heart rate without contact in real time to prevent dangerous situations. It can predict critical situations such as seizures, falls, cardiac and respiratory arrests for timely response. We do not analyze the fact of the falls. We have a vision that we can predict it in 10 or 15 seconds. We can also analyze day and night activities, for example, apnea, insomnia, to make reports about patients' hidden diseases with breathing. Additionally, we started testing to determine the early stage of COVID infection due to heart rate changing or breathing rate changing for immediate isolation of a person. As for stack of technologies, Pulsar solution consists of two components. They are high-frequency sensors based on microradars and artificial software for analysis and forecasting. How it works? Sensors are installed on the walls or bedside in the room and connected to the Wi-Fi, as you can see in the picture. In critical situations, the system automatically alerts doctors, guardians, relatives for immediate help. All signals are sent to the web application, which can be accessed by using your individual account. Pulsar team consists of 9 people. Two key people, they are co-founders, Sergey and Igor, and the rest of the team are marketing, legal support, operational support, engineering staff, of course, medical advisor, and BDM. We also participated in different world development programs. For example, this year we were in super final of Nordic Context Arctic 15. We pitched among 10 companies. We were in KIUAS and Sampo Accelerator this year in Finland, and last year we were in Canadian Accelerator, YEDI. What we're looking for here? We're looking here for potential partners to launch pilots and commercial projects. We're also looking here for technology partners to localize our product. Thank you for your attention, and feel free to contact Sergey or me, Evgenia, if you want more information about product. You can also visit our website, pulsar.com, for detailed information. Thank you.
Hi, we are Rihabu Exercise Games. I'm Peter Green, founder and CEO.
I'm Kati Lähtenara, founder and COO.
We do exercise games.
Rihabu Active, an exercise game where your body is the game controller. Based on professional physical therapy, making activation fun, empowering, and immeasurable. Cloud-based AI for motion sensing for any device with camera and screen.
So Rihabu founded in 2016, is an exercise game studio focusing on activating people.
We have a powerful team of 5, and we fight inactivity.
With our games, the player's body is the game controller. You play online either on a totem setup, a bigger screen, or on your laptop or mobile device. And playing together is much more fun than playing by yourself. Our secret sauce is really the real-time motion sensing, which is on cloud-based AI algorithms with no other equipment needed than the camera on your device. So let's do things together.
We are looking for various partners, and investments will be used for scaling and international growth.
All right, and thank you very much. We are Rihabu.
Hello, I would like to introduce you to the software solution that's revolutionizing diabetic eye care. My name is Stefan Einarsson. I'm the CTO and co-founder of Retina Risk. A bit about our company. Retina Risk was founded in 2009 by a world-renowned team of doctors to transform the future of healthcare by providing individualized risk assessments. Our focus is on diabetic eye disease, and it is one of the leading causes of blindness in the world, which can be prevented in over 90% of cases with early detection. Diabetes, as you know, is a global problem. About 463 million people have diabetes currently, and in 2045, it's estimated to exceed 700 million. Diabetic neuropathy, or eye complications from diabetes, is the leading cause of blindness in working age adults. And with annual screening and treatment, blindness can be prevented efficiently. However, this is a one-size-fits-all, that every diabetic patient be screened every year. This brings substantial medical and societal costs for those countries that are able to have such programs. Our solution at Retina Risk is to offer personalized eye screening for the risk of sight-threatening retinopathy. We utilize our expertise and understanding, and we have developed a unique solution where 6 risk factors can provide an accurate risk assessment. And those factors are gender, type of diabetes, duration, retinopathy diagnosis, and blood sugar and blood pressure levels. We have been extensively validated in over 25,000 patients in studies from Denmark, Netherlands, Spain, UK, Norway, and we will have a study published later in the year from India. We are CE marked as a Class 2A medical device. What we offer is to enhance clinical safety and personalized care with individualized risk scores, to stratify your patient base, to easily identify the risk of each patient if they're low, medium, or high-risk patients. And with that knowledge, you can streamline your eye screening programs for diabetic neuropathy in an efficient and cost-effective way. And with the introduction of variable screening, you can increase the capacity of your patient base by 40 to 60% without increasing staff. Retina Risk has been shown as well to work well with current AI creating fundus images, and it works perfectly together. What we have is 3 ready-to-market products. A mobile application, which is focused on the diabetics themselves, to raise awareness of eye complications from diabetes and to better inform them of their current status, the risk of retinopathy, and to motivate them to improve their status. For healthcare providers and clinics and such, we have a portal that they can access to easily get the risk assessment of each patient, get how likely they are to get diabetes eye complications over the year, and as well what the risk factors are that greatly factor in the risk assessment. And as well the recommendation of screening interval and generate nice patient reports. For healthcare systems, we have an API solution that basically we can easily integrate into established systems that they can get in their current workflow, get the risk assessment tools, get the variable screening, and as well the option to identify the whole cohort to basically prioritize the option to prioritize high-risk patients and such in their high screening programs. And in general, just for the doctors to be better informed of a standard way to view each patient. Modes of collaboration. We're looking for a business partnership to expand our go-to-market strategy in Asia. And we're looking to raise funds as well to increase the rapid growth of our customer base and scale our sales and development teams. For more information on our research and services, please visit the website at enrisk.com. And thank you very much for listening.
Hello, my name is Ville Hakala from Sophie Filtration based in Finland. And we have developed an innovation in industrial water filtration that we call the Sophie filter. Our team consists of highly experienced water treatment professionals and mostly in the heavy industry filtration. Myself have a minerals processing, so mining background. We have our North American director, Steve Luck, with the background from Dow Chemical Company. And most of the work we do is within the realm of cross-flow filtration and the ultrasonic technology development. Now, one often comes across, for example, in processing industry, two large streams of water that contain very fine particulates. And these kinds of waters are difficult to treat with traditional methods like settling, because there is that finest fraction that doesn't settle efficiently. So that's why processing equipment is required to treat such waters. So on the left-hand side on this slide, you see a sample water of a fine particulate contaminated water, and on the right-hand side you see a filtrate through our Sophie filter system with a 10 micron screen. Our technology has three key features. We use a high velocity novel cross-flow filtration method that creates a high flux. That means that we get the high treatment capacity in a very compact size. Then we use metal wire mesh filter elements. So they are sustainable, usually stainless steel, so it doesn't require those disposable filter changes. And then thirdly, we have a integrated ultrasonic cleaning system. So it's a very efficient cleaning. So once the contaminants clog the filter, the system automatically starts the ultrasound and then cleans itself. So it doesn't require any operator attention. It doesn't require those regular bag filter or cartridge filter changes, and it doesn't require in normal operation any chemicals. So we can have the system running by itself in a remote location like a mine site would be. We are focusing in three industries. So mining, I mentioned, the steel manufacturing, which uses a lot of water. So that's a sustainable issue there. And then we are focusing also in oil and gas, and mostly in upstream oil and gas, where the drilling operation produces a water that needs to be treated, and that's where our system comes in to help. For this kind of participations, we are looking at different models of collaborations. One is, of course, R&D. We would be talking about filter elements, sustainable filter elements, metal types, and we would be looking at the ultrasonic cleaning and enhance that. Then we are also looking at projects, so meaning end user type of projects that would require piloting. So we may have a let's say R&D center of a major steel manufacturer that wants to test our filter for a certain application, and then we are happy to do that. So we have mobile field equipment available for such activity. And then thirdly, we are looking for channel to market partners. So we are based in Finland. We have an office in Texas, but the water treatment challenges are global. So we are looking at mostly systems integrators that would buy our technology as components, then build the whole process train for the end user to use. And this was my short presentation. I hope you liked, and please feel free to contact for further information. Thank you.